Welcome to our new video, Medical and Surgical Nursing MCQ. A patient complains of headache and neck pain. During examination, the nurse finds that bending the neck forward towards the chest is painful. What could this indicate? Migraine, meningitis, sinusitis, tension headache. The correct answer is option B, meningitis. Explanation: if a patient has a headache and neck pain and bending their neck forward hurts, it might be due to meningitis. Meningitis is an infection or swelling of the protective layers around the brain and spinal cord. It can also cause fever and sensitivity to light. Which position is recommended for a patient with increased intracranial pressure? Supine with the head flat, front position, semi-fowler position, Trendelenburg position. The correct answer is option C, semi-fowler position, head elevated at 30 degrees. Explanation: elevating the head of the bed to 30 degrees helps improve venous drainage from the brain, reducing intracranial pressure while maintaining adequate cerebral perfusion. Other positions can potentially worsen ICP or impair venous return. Which electrolyte imbalance is most commonly associated with tetany? Hyperkalemia, hypocalcemia, hypernatremia, hypomagnesemia. The correct answer is option B, hypocalcemia. Explanation: tetany is a condition that causes muscle cramps, spasm or twitching. The most common reason for tetany is low calcium levels in the blood, which is called hypocalcemia. Calcium is important for proper muscle and nerve function, so when its level drops too low, it can cause the muscle to become overly sensitive and start twitching or cramping. Which organ is primarily affected by Wolff-Parkinson-White syndrome? Heart, brain, liver, lungs. The correct answer is option A, heart. Explanation: Wolff-Parkinson-White syndrome is a condition that affects the heart. In people with WPW, there is an extra electrical pathway in the heart that can cause the heart to beat very fast or irregularly. This can lead to episodes of rapid heartbeats known as arrhythmias. Normally, the electrical signals in the heart follow a specific path, but in WPW, the extra pathway disrupts this flow, leading to the abnormal heart rhythm. What does overstretching or tearing of a muscle or tendon refer to? Fracture, strain, sprain, dislocation. The correct answer is option B, strain. Explanation: a strain happens when a muscle or tendon is stretched too far or gets torn. This can happen if you lift something heavy, move suddenly, or overuse a muscle. It's like pulling a rubber band too hard until it snaps or stretches too much. Which instrument is used to measure intraocular pressure? Sphygmomanometer, thermometer, tonometer, stethoscope. The correct answer is option C, tonometer. Explanation: a tonometer is specifically designed to measure the pressure inside the eye, intraocular pressure. This is important for diagnosing and managing conditions like glaucoma. Which position is typically used for a sigmoidoscopy? Supine position, lithotomy position, SIMS position, Trendelenburg position. The correct answer is option C, SIMS position. Explanation: sigmoidoscopy is a procedure where a doctor examines the lower part of your large intestine sigmoid colon using a thin, flexible tube with a camera. For this procedure, you are usually asked to lie on your left side with your knees bent, a position called the SIMS position. This position helps the doctor get a clear view of the colon and makes the procedure easier and more comfortable for you. During a blood transfusion, if a hemolytic reaction occurs, what should be the first nursing intervention? Administer antihistamines, stop the transfusion immediately, increase the infusion rate of normal saline, inform the patient's family. The correct answer is option B, stop the transfusion immediately. Explanation. The first step in managing a hemolytic reaction during a blood transfusion is to stop the transfusion immediately to prevent further harm. Then the nurse should notify the doctor, administer supportive care such as fluids, and monitor the patient closely. Log rolling of a patient is typically done in which situation? To assist a patient with breathing difficulties, to reposition a patient with a spinal injury, to prevent bed sores in a bedridden patient, to help a patient with leg fractures. The correct answer is option B, to reposition a patient with a spinal injury. Explanation. Log rolling is a technique used to move a patient while keeping their spine straight and elegant. This is especially important for patients with spinal injuries or conditions to prevent further damage. Which type of soft tissue injury involves the stretching or tearing of ligaments? Fracture, strain, sprain, contusion. The correct answer is option C, sprain. Explanation. A sprain is when the ligaments which hold your bones together at a joint are stretched too far. This usually happens if you move or twist a joint, like your wrist or ankle, in an unusual or forceful way. It's like overpulling a roof until it gets damaged. Which of the following should you avoid when treating a soft tissue injury with ice? Applying ice directly to the skin, elevating the injured area, applying ice for 20 minutes at a time, none of the above. The correct answer is option A, applying ice directly to the skin. Explanation. When using ice to treat an injury, you should never put the ice directly on your skin. This can cause damage like frostbite. Always use a cloth or towel between the ice and your skin to keep it safe. Which of the following syndromes primarily affects connective tissue? Down syndrome, Marfan syndrome, Turner syndrome, Klinefelter syndrome. The correct answer is option B, Marfan syndrome. Explanation. Marfan syndrome is a genetic disorder that mainly affects the connective tissue in the body. Connective tissue is like a glue that helps hold everything in place, such as the skin, joints, blood vessels, and organs. People with Marfan syndrome often have very flexible joints, tall and slender bodies, and heart problems because their connective tissue is weaker than usual. Thanks for watching. Subscribe MCQs 1 for latest nursing MCQs.